to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. Today's episode is all about a topic we see far too often. What happens when you're misdiagnosed or given a rare diagnosis? And then nothing. No plan, no answers, just confusion and frustration. Maybe you've been given a diagnosis that doesn't quite fit your symptoms. Or worse, you've been told that you have a rare condition and sent on your way with no treatment options or support. If that sounds familiar, then we're glad that you're here because you are definitely not alone. Joining me today is Christine, a member of our team. Welcome, Christine. How are you doing?
Hi, Dr. Borelli. Hi, everyone. Well, thank you so much for having me here. And yeah, I'm really glad to be here. So, yeah, let's start with the big question, shall we? Why does this happen? Like, why are so many people misdiagnosed or left in limbo with rare disorders?
Great question. And there's a few key reasons, in my opinion and experience. First, medicine isn't always black and white. A lot of people forget that it's actually an art. And doctors and other providers have to piece together symptoms like a puzzle. And not every patient presents the quote unquote textbook version of a disease. So, on top of that, today's healthcare system is overloaded. Appointments are rushed, providers are often double booked, and they just don't have the time to do deep dives on complicated cases. The system and logistics, unfortunately, doesn't allow for it. And even when they do want to, there's limited bandwidth. Plus, medicine is evolving constantly. New research, new diseases, new treatment options. It's impossible for any one doctor or provider to stay on top of it all. That's definitely not an excuse for the issue, but it helps explain why patients often fall through the cracks.
Yeah, that's totally right. So let's talk about how this affects patients. So when you are dealing with wrong diagnosis or, there's no treatment plan at all, it takes a serious toll, right?
Absolutely. We see patients who feel defeated, exhausted, confused, and even depressed. They know something is wrong with their body, but they feel dismissed or unheard, overlooked. That kind of emotional stress can be just as draining as the physical symptoms, and it can affect your quality of life. You're missing work, canceling plans, inconsistently in and out of doctors' offices. It can feel incredibly isolating.
For sure, that's for sure. So let's shift to solutions. So what is a private patient advocate and how do we help in this type of cases?
So, a private patient advocate is a healthcare professional who works directly for a patient, not for an insurance company or a hospital. Our role is to help patients navigate the healthcare system, find the right providers, understand the diagnosis, and coordinate care, and honestly, so much more. At Pathway Patient Advocates, we're here to walk beside you and help take the weight off of your shoulders. Another very important feature is that we're unbiased. Our only agenda is your health and your goals, not what's most convenient or profitable for the healthcare network.
That's totally right. How can a private patient advocate like us help if someone, feels misdiagnosed or lost with a rare disorder?
Good question. So, there are several ways we can help. First, we help connect you with the right specialists, people who are actually equipped to understand your symptoms, your condition, and experienced. We also review your medical records and look for inconsistencies or missed patterns or gaps in your care. We work with you to build a timeline of symptoms to help you ask the right questions, prepare for appointments, attend appointments. I mean, there's so many key steps in the process that we do, but the most important thing is that it's very personalized to what you need in your specific situation. And because we've worked with so many patients who've been misdiagnosed or had rare conditions, we often recognize red flags or patterns that others might miss. We can also help save time and money by narrowing down the best options faster and avoiding repetitive or unnecessary testing, also leading to reducing your costs.
That's really important. So what do you think is the emotional, value of having a private patient advocate?
One of the most overlooked benefits is simply having someone in your corner. Someone who gets it, someone who listens to your story, start to finish, and not rushes you through an appointment. We're not just here for logistics, we're here for whatever support that you need, whether you're going to appointments, dealing with insurance issues, or having a rough day. We're there for you. When you have a visit that doesn't go well, we're going to talk about it with you and figure out the next steps. You're not going to just, be left hanging and kind of feeling that you don't know what the next step's going to be.
Exactly. Sometimes just knowing you have an experienced ally can make all the difference, right? We've had so many clients telling us they finally felt hopeful again after reaching out to us, and we're able to help them all throughout their healthcare journey.
If you or a loved one is struggling with a rare disorder or misdiagnosed, or even if you just feel like something isn't adding up, don't wait. You deserve to feel heard, supported, and properly cared for. And remember, getting a second opinion or working with an advocate doesn't mean you're being difficult. It means you're advocating for yourself. And most often, if not always, that's actually appreciated because you're offering an additional sense of support to your situation. We work really great hand in hand with the other members of the healthcare team, including your providers. And that's really something to be proud of, that you're taking that step to advocate for yourself.
Very well said, Dr. Borelli. Well, for anyone looking for help for themselves or for their loved ones, can they reach out?
It's really easy. Just reach out to us at Pathway Patient Advocates. Give us a call, 947-517-8395, and email us at advocate@pathwaypa.com. You can also visit our website, which is www.pathwaypa.com. And yeah, we're here to help you.
Amazing. Well, thank you so much, Dr. Borelli.
Thank you, Christine. It's been a pleasure as always. I hope this conversation helps our listeners feel more confident as they navigate their healthcare journey. Have a great day. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.